اسم وزارة الصحة بالكامل؟
وزارة الصحة والسكان.
The Ministry of Health and Population.
ليه
Health and
جمعوا
Population.
الصحة والسكان في وزارة
Why
واحدة؟
did they add health and population in one ministry? As long as there's population, there must be a follow-up of population. Who,
الناتج المحلي
my
المصري
grandfather has 9
$77
children.
مليار دولار.
The GDP was $477 billion for 100 million people. If this was spent for 50 million, what was gonna be the difference? Of course, that was and that was gonna be an investment for the people.
زيادة 3.
Maximum 3 or 2 children. The government would open projects for employment, but education is done by you, not the government. The national income, for instance, is £1,000, and when you have 10 people, the one has £10. The girl can be a minister, doctor, pilot, anything. Do you know what that means, population explosion? The most thing the human being suffers from is the responsibilities that they cannot bear. When there's a lot of children, it is highly difficult to make them feel the normal life. What does it mean, the quality of life? Education, health, housing. I have 6 girls who got married, but I'm still suffering. But they all didn't have the proper education. Only one of them is a university graduate. The more we have population, the more pressure on the services, education, health, and so on. What would you like to tell the child number 105 million? I'm optimistic about the future because too many achievements have been done. Ladies and gentlemen, esteemed presence, we meet today under the slogan of Population and Health for Sustainable Development. Let us welcome the Minister of Health and Population, Dr. Khalid Abdul Ghaffar, to deliver his speech and launching the strategy for population 2023-2030. In the name of Allah, most merciful, most gracious, Mr. President Abdul Fattah al-Sisi, President of the Republic, ladies and gentlemen, esteemed presence, allow me to extend my greetings to Mr. President for coming and for his auspices for this important Congress. We meet today in the administrative capital, which hosts this event, where we discuss with the world states some of the very important issues for the future of this planet, which is health and population. Organizing this Population, Health and Development Congress 2023, after 29 years of the Population and Health conference held in Cairo, to review the international matters of population and development. This is the most significant challenge to Egypt in the present and in the future, because it hinders the efforts to development and the economic growth, affecting the level of services provided to citizens and the level of their living. Due to the imbalance between the economy and the population growth, eliminating poverty and hunger, and keeping up with the health and education systems is more difficult by the population growth. So, achieving the SDGs, especially related to education and health and equality between genders, will reduce the reproduction rates and increasing investments in the human element to guarantee reaching good quality education and health services for all age groups, and strengthening the job opportunities for all age groups as well. The increased population growth is an issue of a homeland and a people. It is a destiny. Allow me, Mr. President, to review the vision of the Ministry of Health launching the national population strategies dealing with the population growth, maximizing the quality of life. Mr. President, in the Youth Forum in July 2017, you spoke about a very important challenge facing Egypt, which is terrorism and increased population growth, which hinders Egypt's opportunities to move forward. Also, an institutional entitlement in Article 41 indicating that the state commits to a population program that balances the resources with population and maximizing resources and properties in the framework of achieving sustainable development. The issue of population in Egypt is not a matter of today or yesterday. It goes back to 60 years ago. The population program started in 1962, and then attempts followed along 60 years through establishing councils for family planning and for population, and then establishing a ministry for family and population affairs, and then the 2022 project for planning and population, and now launching the national population strategy in 2023. During this period, the Egyptian state managed to achieve successes that are mildly ambitious, which we started with a reproduction rate, and I mean by that ladies in reproductive age of 49 years old. It was reduced to 3 children per lady, and it got back to going up in 2014, and during the census by the Statistics Council, which I salute for their efforts by only Egyptians to issue the Egyptian census. And then we resorted to going back to the history. We learn a lot from our history. If we go back 123 years ago in 1900, we had 9 million people. We were 19 millions after 50 years. In 1950, the population growth rate was 10%. In 50 years, the surplus of the trade budget was high, and the Egyptian pound equaled a gold pound, and the dollar was worth 20 pennies. The growth rate, the population growth rate was balanced with the GDP then. We had the biggest monetary coverage worldwide. This is important because we had balance then, and Egypt had 4 million acres accounted for the citizens. The individual share was large, but the agricultural plot did not increase, but the population increased. The requirement and need for services increased, and there has to be services and economy in line with this number of increased population. In 1930, the students registered in universities was 500,000 students. Now we have over 3 million students. In the past 9 years only, we added 40 faculties and universities to the system to accommodate over 3 million students per year. Now we have 60,000 schools and hundreds of thousands of classrooms. The education system in 2020 graduated many good students, but with a different time now. Transports and road maps in Egypt and the railway was the most sophisticated worldwide, but it wasn't developed right in line with the population growth rate. It could work to serve 15 million persons, but now we have over 100 million Egyptian citizens and 10 million guests from foreign countries. So now the railway is serving over 120 million persons. The demographic change that happened starting from 1950, and then the change and the imbalance between population and development and services took place. The Egypt station or the railway station, the streets are the same, the areas are the same, but the numbers of people were then 20 million, but now we have 105 million for the same station, for the same street. How can we expand the services to accommodate all these figures and numbers that affected the development plans during the Egyptian history? After 1900 after 23 years only, we were increased by 40 million. So this deep burden on the economy and the development plan is a challenge for the welfare and well-being of the citizen, which is the title and the theme of our conference. The total resources of the state that was imbalanced since 1950. Look at the 1900 when the resources were 10 million and the uses were 10 million. And then we started with a slight imbalance and deficit. And then in 2023, the resources were increased to $1.5 trillion, and the uses and requirements were 3.2 trillion pounds. Absolutely, there is economic growth and development, but doesn't balance the population growth rate. This is a very popular equation to achieve the development from the population properties. But Egypt is not the same as any other state. We had our fair share of terrorist events, wars, revolutions that deeply affected the economic growth and also affected the health services, and therefore the population growth rate. Even throughout crises, we had safe rates and then growth rates, and then we witnessed a severe reduction as we have witnessed in the past crises like the pandemic and the war, as the world has witnessed. But does only Egypt suffer from this population issue? Let us compare between Egypt in 1955 and Germany, which had 71 million persons in 71. Italy was 48 million pounds and about double the population of Egypt. In 2023, we can find that Egypt has 100 million persons. Germany was increased only by 11 million. Egypt now is sevenfold in Germany in 67 years. This affected the share of an individual in the GDP, since the spending rate on services is accelerating, so the individual share in spending or the national income reduces. If we look at some of the states, similar states, which started as the program in the 60s,
للسيدات في سن الإنجاب، والرقم السفلي هو الرقم الذي وصلت إليه بعد نجاح معدلات الأداء في القضية السكانية. مصر حققت.
Egypt has achieved in 6.7 to 2.9. Is this what we hoped for? Of course not. After 60 years in working in on the population issue, we hope to reach 2.1 to achieve real balance between averages of reproduction. If we compare between Egypt, Iran, and Turkey, we can find that Egypt is, by 2050, expected to increase population by 17 million, and Iran, which succeeded, increases in 10 years by million persons. Of course, the savings can affect the population very positively, as well as the social advantages to reach 549 million pounds compared to 356 million during the past few years, to be in balance with the population growth rate. If we regarded the individual share in the GDP compared to other states, we find that the GDP in Egypt improved during the years, but the individual share remained humble. And therefore, we can say that family planning is the biggest investment project that can be adopted by Egypt. With a small accounting, every pound can be spent on family planning will make lots of saving in food and water and education and health. We are increased daily by 5,083 newborn a day, 4 newborns a minute, and 1 newborn a second, 15 seconds. Every 2 days we have 10,000 newborns that require how much hospital beds and classrooms and vaccines and healthcare services, places in universities and schools, food and water security. And therefore, the state during the past period invested a lot in national projects to keep up with this population growth and the heritage, this heavy heritage that started since 1950. We developed most of the services. We beat a lot of slums by establishing new areas, new cities, universities, agricultural plots, schools. Lots of investments worth 10 trillion pounds in 10 years only. Well, these funds, other than the social protection programs and the commodity support, of course.
ماذا لو كان معدلات الإنجاب
The reproductive rates would have been reduced during the years, and if we had
هل كنا
less
نستطيع أن
population growth rates,
إلى ادخار قومي
could we have directed this
وزيادة دخله ويكون نصيب الفرد في
subsidizing the support to more development projects and investment in the human element to improve the quality of life and services, increasing job opportunities and the productivity of an individual would have been lots
الحق به وهو النمو السكاني.
more.
الآن لسنا في حديث عن
Now we're not talking only about the population issue in terms of quantity. Of course, the quantity is important, but what's more important is quality and the demographic dividend.
المواطنين مثل الصين
Because there are billions in China and India who transform this capacity
اقتصادية إنتاجية
to a productive economic capacities
العالمي
affecting the global economy.
بالوضع السكاني في مصر.
And I mean by the population status in Egypt that reached 105 million in addition to 10 million guests in Egypt,
التعليم ومن
enjoying all the Egyptian citizens' rights, such as the Egyptian citizen. If we talk about
هو تكوين السكان ممكن
the population composition in Egypt,
منتجين
there are productive, educated, healthy
إلى الاقتصاد القومي.
citizens adding
إحنا لا
to
نتدخل في عدد
the
الأفراد. هذه حرية والدولة لا
Egyptian economy. We do not interfere with the number of children and newborn, but the state must guide the family to establish a healthy, happy family that can add value to the society. We have 35 million citizens from 1 day to 15 years old, and this is a very strong addition to a young nation. 65 years old and up, we have 6.7 citizens in this age group. Those who are in the working stage are 61 million people.
معدل الإعالة وهي كلمة
The
لابد أن نتذكرها
supporting rate, every 100
ماشي
citizens
معاه في إيديه
are supporting for
مواطن يصرف
61
عليهم ما بين
citizens.
55% منهم صغار
55% of them are young and 8% are
نتمنى
elderly.
أن معدل الإعالة ينزل
We hope that this rate declines to 50 and 40 and 30,
في ال100 مواطن
because the burden on the 100 citizens
يصرف على تطعيمهم
supporting for 60 persons
إنتاجه
are spending
وأيضاً بيصرف على
on
الرعاية الصحية
and supporting for the health care services for the elderly and the education and all the services required by the younger.
تونس وتركيا هنلاقي إن معدلات
If we view Indonesia, Turkey, and so on, they decline these rate to 36%,
مواطن في هذه الدول
which means that each
مربوط بيه
100 millions only support for 30
أن يكون الفئة العمرية في مرحلة الإنتاج والعمل في مصر
citizens.
هي الأكبر
And we hope to
لكن
reach
بشرط أن
that
تكون
rate,
لا يوجد بطالة
provided that
لأن
we do not have unemployment. We are not only speaking about employment, we're speaking about employment that can add value to the state. This is the current status,
فيتم زيادة في أعداد
which if declined
وهو ما يسمح باستثمارات
will allow bigger investments,
زيادة في
and therefore the national
أما عن الخصائص
production will increase.
فهي
The
السمات والعوامل التي
demographic
تصف
properties, these are the features describing a population in some certain area.
التعليم ليس بالضرورة
We might not have the
معدلات الإنتاج
hoped
ومعدلات
for
التوظيف
quality of
أقل
education
بالفعل.
or employment.
وهي الخصائص التعليمية والصحية
The education
والتشغيل
properties,
والمهارات
the health
الحياتية.
properties,
من المؤكد
the life
عندما يكون
skills,
هناك
of
فائض
course,
الادخار
when there is a
في
surplus
الناتج القومي
in
المحلي
the
سيتوجه هذا
savings,
الفائض والادخار
this will be
بدلا ما
directed
يصرف على
instead
التطعيمات
of
وإنشاء مدارس
vaccines
جديدة وإنشاء
and
جامعات جديدة
establishing
وإنشاء
new schools
مرافق
and
جديدة،
universities and
سيتم
facilities.
توجيهه إلى
It will be
الاهتمام
directed
بجودة
to the
الخصائص
attention
السكانية من
to the
تعليم وصحة
quality of
وتمكين
the
وإنتاج.
demographic properties.
إذن حقوق من ضمن
So
حقوق الإنسان هو حقوق
the
الطفل،
human
حقوق
rights
الأم،
include
حقوق الأسرة في حياة
the
سعيدة،
mother
في أسرة
and
قوية
child rights
ومتوعية،
in a
في
very strong
تأجيل
and happy
الحمل
family
لمدة سنة، في
and
تباعد ما بين
postponing
الحملين من 3 ل 5 سنوات.
pregnancy
وأطلقنا
for a
برعاية
year,
كريمة من سيادة الرئيس مبادرة
and we launched
غرار المبادرات الرئاسية
an initiative, a
وتم
presidential initiative
حقوق الطفل في رعاية صحية آمنة
to guarantee the child rights psychologically and socially and health-wise when there is a space between one child and another. We do not say how many children should a family have, but we interfere in the quality of life. But and about is the demographic dividend. It is the potential benefits of population to be able to reap these demographic dividends. We should provide new job opportunities and new housing units so that the population can contribute and invest in the state productivity. And this actually happens in 15 to 20 years. Reaping these demographic dividends, it requires time so that the demographic composition change. The children that we have mentioned after 10 years will be getting married, whether females who are going to even to increase the population. So we expect a new population increase in 10 years. So we should all be qualified and rehabilitated to receive these newborns after 10 years. So that Egypt can maximize the use of these benefits, we should have strategies and reduce the lack of education and prohibiting the marriage of underage girls, increasing the female contribution, which is women empowerment, and promoting the governance and social protection. It is a package of measures that should be followed, evident in the strategy to reap the demographic dividend. Also creating productive job opportunities, not just service opportunities, to add value to the GDP, and preserving the political and social stability, so as what Egypt witnessed during the history of crises had a negative effect on our topic today.
نستطيع نحقق العائد الديموغرافي والخطوات التنفيذية للاستراتيجية.
Perhaps what we should pay attention to is the unmet need that reached 13%. Some families want to plan their families, but they cannot find the reproductive counsel that they require. There is a child, an unwanted child, one of every 5 children wasn't planned. This can be achieved very fast and maximized.
رصدنا ايضا من خلال المسح السكاني ان الريف
We also
مستوى الانجاب اكثر من
saw
الحضر،
that the reproduction rate in the rural areas is more than the urban areas, so we have a clear plan
معدلات الانجاب
where to focus our efforts
بتدني مستوى
in
تعليم
terms of family planning, which is related to unemployment, education level, and some issues related to poverty and so on in these areas. And we can
دراسات اقتصاديه
spread new culture and new studies in these places, in these areas, to control the growth rate in these areas.
ومن هنا جاءت الاستراتيجيه الوطنيه التي
Starting from here, the national strategy in 13 August,
تكليف الوزاره
when the president assigned it to the ministry to put the population map on the top priorities of the Ministry of Health during a complete year.
هذه الاستراتيجيه لسياده الرئيس
We presented this strategy to the president, working through axes and international collaboration on national and regional level, which we paid attention to constitutional entitlements, SDGs, and Egypt Vision 2030,
الجهاز المركزي وايضا المشروع القومي
as well as the national project for Egyptian family development.
عنصر هام من قوه الدوله
It is a very important element from the comprehensive ability of the state,
وهذا هام جدا وايضا
so that every family can decide on how many children they want to have.
المكون السكاني في
And in incorporating the population element in the development plans, creating the appropriate programs to have participation in all over Egypt, following up with the population rates in all governorates and cities and villages, paying attention to the religious values and morals in the Egyptian society,
وايضا الاستثمار في
guaranteeing the rights and investment in women empowerment, in the human element, and the necessary projects fighting marriage under age and lack of education, a bunch of measures taken in the state to reach the national project
تحقيق اهدافها
and to achieve the strategy goals.
بين السكان والتنميه
The hope is to achieve balance between
الاهتمام بالخصائص
the GDP and the population to reach the welfare and well-being of all citizens. There are high indicators, 2.8%. We need to reduce that.
مستهدفين 75
Family planning methods, we are targeting 75%. We know the method, we know the how, we know the when. We have this strategy, ladies and gentlemen, was set in collaboration with all relevant authorities, accrediting the previous
ان نضمن عوامل التي
experiences to guarantee the success rates represented in Mr. President, who have eliminated hepatitis C when the state took over this file. The Egyptian state achieved a great accomplishment eliminating hepatitis C, which the homeland has always suffered from. And I think that there is consensus between the Azhar and the church, the Egyptian church,
الى انخفاض معدلات
reaching success rate to really reduce the birthing rates.
شخصيه مصر للدكتور جمال
And finally is the book of the character of Egypt for Dr. Gamal Hamdan.
منذ الستينات
That was produced during the 60s and 70s of the past centuries, that there is no problem in Egypt except with the population problem was the main element. It is a substantial element for all problems in Egypt. So there is no solutions except with handling this one. Thank you, sir.
أنا اللي بشكرك دكتور خالد.
Thank you, Dr. Khalid, and allow me to welcome the dear guests attending the conference and thank them
والحقيقه
for their presence.
ده بيشجعني ان انا اقول ان مهم قوي
This encourages me to
وهيسعدنا واحنا مستعدين
say that we are going to be happy to plan this conference on annual basis. It is a great opportunity and a platform,
ومنصه مهمه جدا ان احنا
a significant platform to propose ideas, exchange visions
مشكله السكان مش بس
about population. And I hoped that you talk about
سريعه جدا عن
the volume of the world resources to balance the population growth rate in the world, not only in Egypt. What is happening in Egypt is somehow exactly what is happening worldwide. For example, in Africa, we are talking that in few years we are going to reach a billion and 600 peoples. We do not have enough resources to meet the needs of this. So I would like to reaffirm that we should plan this conference on annual basis in the light of this very important theme. And allow me to speak a little about Egypt, since you are very dear guests and we are honored to have you here. This state with 105 million citizens and 10 million guests even, how this state with their very limited resources can coexist.
أنا لفتت نظري كلمة في الفيلم
In the film presented earlier, when one lady mentioned that the hardest thing is to have requirements of a family and you are unable to meet these requirements. It looks simple, but it reflects the feeling that I have. Honestly, I'm talking to you, and for the Egyptians, it is the hardest thing that the required is too much for what we have of resources, and this will absolutely be reflected negatively on quality. If you want to have a very good education, you need higher spending in the light of this increasing population rate. You even talked about the 50s, and the gap was 10% between the state resources and the growth rate. We had only 20 million people, and the gap wasn't that large. But pay attention, this gap had accumulations on 60 and 70 years. The impact of those 70 years on the quality of the education product, the health product we as a state want to provide to our citizens. The issue of population in Egypt and in similar states, it is a very important issue that affects these states. Allow me to say that we in Egypt, we witnessed 6 wars, 7 wars. 1956, the Yemen War, 67, 1973, and the war terrorists, the last of which was the war that lasted for 10 years since 2011 and until 1 year ago. It costed the state a lot, and the stability and security situation that you mentioned
امر في منتهى الامان
was highly important for the development of the state. It is significant for handling the population rate. We didn't make
هل
it
معناه ما كانش فيه
in 60
إرادة
years.
سياسية؟
Does it mean that we had no strategies or political
القائمين على
will
الدولة إن
or
الوصف
awareness
هو
of
مشكلة
the
كبيرة جداً
population
أصبحت
problem
أو
that
بتواجه
is
الدولة
going
المصرية
to face
ونموها
the
ويمكن
Egyptian
استقرارها في وقت من
state
الأوقات؟
and will
أتصور
hinder
إن
its
هم
stability?
كان واضح
I
معاهم.
think they knew 60
ولكن
years ago, but
يا ترى كانت المحافظة على الهدف
preserving the goal
وآليات العمل
and the mechanisms of
المطلوبة لتنفيذ
actions
الاستراتيجية
required to achieve
كانت قوية
and implement
وماسكة
these strategies were well established and stable enough to be actually implemented.
بتتكلم في 2.1 من 10
Actually, it weren't.
وانا بقول لك والكلام
They
ده قلته
weren't.
للدكتور هالة قبل كده
I told this to
انت
Dr.
عايز
Hala before.
700,000
We
مولود
require
سنوياً، لأنك أنت مش بس عايز
400,000
تخطط
newborns a
تصل
year.
2.1 أو 1
We
أو 1
not we want to
لا،
reach
أنت عايز تعوض
1.5.
العجز
We
اللي
need
نجم عن
to
الفترة
compensate the
70 سنة اللي
deficit
فاتت بإنك أنت
that
تصل
happened
إلى
in
في
the past
فترة
70
زمنية
years to
تصل
reach
ل 20 سنة وبعد كده تبتدي
400,000
أسمح
a year
للنمو يبقى أكتر من
and
كده.
then allow
بالمناسبة
the growth rate to be higher.
الإيرانيين عملوا كده والأتراك
The
عملوا كده
Iran
والصينيين
did
عملوا
that,
كده.
Turkey
بعد ما
did that, China did that
البرنامج في
after
الصين بدأ
they
تقريباً 68.
the Chinese program succeeded in
خليني أقول لك
which
هنا
started in 1968, and let me tell you here.
أنت قلت إن الإنجاب حرية كاملة يعني.
You mentioned that
بس خلي بالك إن كل
giving
شيء
birth
تنظم
is
بطريقة
a freedom, but if not regulated, it can cause a crisis
معنى
and
الحرية
catastrophe
بإطلاقها
to
أنا
this
يعني
state,
مش
to
متفق.
this country. I do not agree with you
عملية الإنجاب
the absolute freedom in the reproduction matter
مدركة بحجم وحجم التحدي
to people who are not really fully aware of the problem
في لما
is not
الأتراك
right.
عملوا آسف
When
لما الصينيين عملوا الكلام ده من 68
China
جم
did
في
that
2017
in 1968,
وأطلقوا مرة
they
تانية
came in
أكتر من كده.
2017
إمتى عملوا كده؟
and
بعد ما حققوا
released
النجاح وظبطوا النمو
the
السكاني،
strategy
ويمكن السنة
to
اللي
have
فاتت
more
أول
than
مرة
one child.
في تاريخ
And
الصين
last
الحديث
year was the
يحصل
first
تراجع
time
في
in
عدد
the history
السكان
of modern China there was a decline
في
in
النمو، لا
China
يرجع عدد السكان أقل مما
population growth
طيب، ده
rate.
اتحقق بإيه؟
How was this
اتحقق على مدى
achieved
كام سنة؟
and
المدة
on
تقريباً
how
اللي
many
احنا فيها المشروع.
years?
هم
About the same period we had a project and they even launched their project after. They were able to implement the program, but we weren't. We need to be able. It's not just about the awareness. I can know about the problem, but not taking the necessary steps. I'm talking about the citizen here. The citizen may know that the population is a lot, but I'm not really going to make much of impact. They don't have the necessary will because they cannot see the influence on their small family. I don't want to be long. The problem in Egypt is very substantial in Egypt, and it was significant in the challenges we faced since 2011. Why did people come out in the 2011? Because the state wasn't able to provide what's required. It wasn't because the state did not want to provide the necessary services, but the capacities were very limited to provide and meet the requirements. Then the infrastructure projects were costed 10 trillion pounds during the past 10 years. Some think that these funds shouldn't have gone to these projects. There was a lack of awareness because in 2011 people protested because of the description given that this state cannot meet the requirements.
وانا بقولها تاني
With
وكل
this
مرة
change, they thought,
لمواطنينا هنا التغيير في
our
مصر
citizens
هيتحقق ان
thought
احنا كلنا كمواطنين وحكومة وقيادة
that
تعمل سويا بفهم ووعي من اجل
working together,
توظيف
people
قدرة الدولة
and
دي على عدد
government
سكانها.
as a state
لكن
to
مش ابدا بنقول
organize and
طب
regulate the growth
زي ما حصل
rate,
كده
the
في
population
2011
growth
طب
rate.
نعمل ثورة ويترتب عليها ان الدولة اللي
So
هي بتقل
a
اساسا
revolution
تخسر
is
400
not
مليار
the
دولار
answer. The state
عشان
lost
هي
$400 million
يعني في احوج ما يكون لكل دولار
when we
فيه.
needed them
احنا
most.
بنتكلم في النمو السكاني هنا وانت
I know we're
بتتكلم في
talking
حاجة
about
تانية
the population growth
في
rate.
ارتباط بينهم تماما
They are
لأن لو ما
very
كانش العدد
correlated
الكبير ده موجود
because if we didn't
خلال
have such
الفترة
high
ديت
number
ما كانتش
of
الناس حست
population,
ان مفيش صحة كويسة
people would
مفيش
have
تعليم
touched
كويس
good
مفيش
services in health and
تشغيل
education,
كويس
in
مفيش
employment.
دولة مش
The
قادرة
lack of these
تقدم
services is
الرعاية
due to
الحقيقية
the increased
للمواطنين
population.
لو كان نمونا السكاني
If
متنظم
our
وعشان كده بقول لك يا
population
خالد
growth
انا مش
rate
يعني
was
مش متفق معاك
regulated,
قوي في موضوع الحرية
we would
المطلقة
have
في
went
عملية
out of many of
المناطق
these
لا يا جماعة
crises. So I do not agree with you about the freedom
لا
of the
ده والله
productive
يعني لو كان الحرية المطلقة
health.
والناس هتستحمل وتسكت خلاص خلاص ماشي مشيوها كده لكن لا الناس مش الناس عايزة تعيش بس هي مش
But
عارفة
people
كمان
want quality of life,
ازاي ان
but
إن
they
كل
do
حاجة
not
بتتحسب
know how everything is going and how the requirements can be met, and they are not aware about the policies to be followed.
العالم اللي موجود معانا
I'm telling
عشان
you
يعرفوا
and the
مثلا
guests
ان الدولة المصرية دي
that the Egyptian
بكل التحديات
state,
اللي
in
بيتكلم
spite
عليها
of all the challenges,
الدكتور خالد قادرة تصمد في مواجهة أزمات
is resilient in the face of the pandemic, the Russian-Ukrainian war, the high prices, the supply chains,
الإمدادات اللي بتيجي سواء كان للسلع أو لكده
whether
أو
for
بتتفق
commodities or so or the
في
coasts.
النهاية
Eventually,
لينا كلنا
I'm telling you all,
الضيوف اللي ما عندهمش المشكلة دي في بلادهم
the guests who do not have the same problem
بل يمكن تكون
in
عندهم
their
مشكلة عكسية إن هم النمو الديموغرافي
countries,
أقل
they have the
من المستقبل.
reverse problem. They have lesser demographic growth.
أكبر وعبء على الدولة الحقيقة ليه تأثيرات ودلالات سلبية كبيرة جدا
We have very
على
negative
جودة
implication on the
وقدرة
quality
هذه
and the capacities of
هو
these
الدكتور خالد
states.
بيتكلم على إن
Dr.
تعليم
Khalid
جيد. وأنا ما بعملش
talks
تعليم
about
جيد.
good
هيبقى فرصة
education.
التدريب الجيدة متاحة لا
Consequently, if we do not have good education, we do not have good employment.
لا
We do not have good
لو ما
healthcare
عنديش تشغيل
services.
مناسب هيبقى المواطن
If we do
ده
not
بيشتغل
have
أي شغلانة يا
employment,
دوبك تسد حاجاته الأساسية
citizens
هل ده
will go
معقول؟
for jobs that
أنا
only
أطلت
meet their
عليكم
basic needs.
لكن برحب بيكم
I know
وأتصور
I
إن
said a
المجلس
lot,
القومي للسكان
but I
محتاج
think the
إنكم تكونوا
National
دافع أكتر كده عشان
Council for Population needs a bigger push to face this problem.
مش عشان بس إن إحنا يعني
Not only
نخلي المسؤول عنه
to
دولة رئيس الوزراء أو حتى أنا
the one responsible be the Prime Minister or even myself, but it's a National Council for Population
إن إحنا نعزز
needs
دوره
at least
خلال
to
المرحلة
be
دي والفترات
strengthened and promoted.
شكل من أشكال النجاح ولكن فأنا هقول دولة رئيس الوزراء يبقى مسؤول هو رئيس المجلس
The Prime Minister can be the head of the council in this stage,
لكن بقول تاني إن الدولة كلها مدعوة
but the entire state is invited and called upon the media, the religious entities, the intellectuals, they all,
الكل مدعو منظمات المجتمع
the NGOs
هذا الدور أيضا
are also called upon to face one of the most significant and substantial problems facing Egypt.
وكان سعيد جدا بالجنيهات
The citizens in the 50s were taking pounds and they were happy with it, but now they are taking thousands of pounds and they are not content.
استاذن سيادتك يا فندم في تقديم نسخه
Please, sir, I would like to present you with a version of the National Strategy on Population for 2020-30. Thank you, Mr. President, for these comments, Dr. Khalid Abdul Ghaffar for the presentation. Now, ladies and gentlemen, we invite you to watch a film entitled Population and Development.
المشاهد دي مش من زمن بعيد، في أجيال لسه موجودين وسطينا وشاهدين على الوقت ده، الوقت اللي كان سهل فيه يروحوا مشاورهم يتعالجوا ويتعلموا صح، لكن في أقل من 50 سنة كل ده اتغير، كل حاجة كانت سهلة بقت أصعب، وكل يوم بقت بتزداد صعوبة. الواقع إن المشكلة السكانية هي سبب
and the population issue is the main reason behind it all.
تضاعف 3 مرات.
In the 60 years,
أول مرة في تاريخنا سنة 2020
the population growth rate multiplied by 3 times. In the past 10 years, we were increased by 20 million people. You know that the last minute we were increased by 4 newborns and the next minute there will be 4 more. With the end of the year, there will be more than 2 million people. They require vaccines, healthcare, and when older, they need public utilities, education, employment, and housing. These are basic needs. Providing them is a natural right, and they are met with huge challenges because it's very accelerated rate. And the national income is not increasing in the same pace. And here comes the gap between the population and the income, and in spite of the efforts to development, it's not well reflected on the quality of life in a very short period to be in line with the population growth rate. The main problem is not about the quantity, but
وجودة الحياة فيها أفضل، ولما العدد مش هو أساس المشكلة، يبقى إيه اللي بيخلي الزيادة السكانية تحدي كبير عندنا؟
The main
زيادة
issue
عدد السكان مش
is
معيار لقوة الشعوب، لكن المهم هو مدى توفر الإمكانيات اللي
the
تستوعب العدد
availability
ده
of
وقدرة
resources
كل
to
فرد على
accommodate
المشاركة
these
الإيجابية في خدمة المجتمع.
population,
وده معناه إن الخصائص
which
السكانية
means
بتشكل
that
دور
the
محوري في حل
demographic
المشكلة من ناحية، وزيادة الناتج المحلي وقدرة الدولة
properties
الاقتصادية
contribute
عليها دور من
majorly.
ناحية. بس لازم نعرف إن العنصرين مرتبطين
And we should know
وبيتأثروا
that the
ببعض
two elements
ويعتبروا
are
وجهين
correlated
لعملة
and they
واحدة.
affect each
ومع إن
other.
الدولة خططت لبناء أكتر من 20 مدينة جديدة علشان تحسن سوء التوزيع الجغرافي للسكان وتهالك البنية التحتية، واستصلحت ملايين الأفدنة علشان تزود كمية الغذاء، وتوسعت في محطات معالجة وتحلية مياه البحر علشان توفر نصيب أكبر من المياه للفرد. ده غير محطات الكهرباء والطرق
Electricity stations, road maps, and many national projects, most important of which is the universal insurance system that includes all Egyptian citizen segments, integrating strategies in development plans to meet the needs of the Egyptian increased requirements. The population growth rate is not only the responsibility of the state and the government, it's the accumulation of all of our actions. The only solution is that we all come together to face the challenges of the increased population growth.
ويعظم الاستثمار في
to
الطاقة البشرية
maximize the
ويحسن
investment
خصائصها
in the human
ونحقق
element,
بيه
improve the
التنمية
properties
المستدامة.
and features,
الفرصة
and
لسه
achieve
قدامنا.
sustainable development. We
والنهاردة
still
بنعلن
have
عن
an
الاستراتيجية
opportunity,
الوطنية
and we
للسكان
today
والتنمية
announce
ضمن رؤية
the
مصر
population
2030
strategy in
اللي
Egypt
هتكون
Vision
خارطة الطريق
2030 to be
لمواجهة
the roadmap
التحديات
to face
السكانية وتحسين
the
جودة الحياة للمصريين. هنقدر من
Egyptian
خلالها
challenges
نحقق نمو مناسب ما بين السكان
through
والاقتصاد
which we
يضمن لنا
can
استدامة
achieve
الموارد
balance
والتنمية
between the
نحسن خصائصنا
resources
السكانية
in the
بشكل
economy
شامل
and the
ومتكامل
population to
فيوفر
achieve
لنا
the
رعاية
economic
صحية
properties,
وتعليمية واجتماعية
allow
نمكن المرأة
social,
اللي هي
educational
أساس الأسرة
and health
فتعرف حقوقها وتزيد
development,
مشاركتها نعتني
develop the
بالشباب
Egyptian
والمراهقين
family and take
نبني
care of
قدراتهم
adolescents
ونمكنهم
and young people,
وندعمهم في
build their
الإبداع
capacities
والابتكار
and
وريادة
support them
الأعمال
in innovation
نغير
and
المفاهيم
entrepreneurship.
والسلوكيات من خلال تطوير
Change
استراتيجية
values
إعلامية متكاملة القضية السكانية هي قضية شعب قضية
and
حقوق
behavior.
لحياة كريمة ومش هنبالغ لو قلنا
And we're
إنها
not going to
قضية
be
مصير
exaggerating if
هدفنا
it is
واحد
said that
نحو
is a matter
سكان
of
أصحاء
destiny.
من أجل
We have
تنمية
the same
مستدامة
objective, which
هدف أي
is
جهد
sustainable
تبذله
development.
الدولة لتحقيق التنمية هو المواطن
Any efforts exerted by the state is a citizen
مستجيبة
meeting the
لتطلعاته في
ambitions
العيش
and
الكريم
aspirations
والسكن
for
اللائق
quality of life,
والعمل المناسب
housing, and
نحو
appropriate
غد أفضل
employment.
للأجيال القادمة.
هدفنا واحد لما الظروف اتصعبت الفرصة جاية وقربت لو نعمل اللي علينا هنعدي بسلام هدفنا واحد بالتعب لسه الأمل قدامنا هو كتير اتعمل الفعل دايما أقوى من كل الكلام حلمنا واحد لو نتعاون هنغير شكل بلادنا هو تحدي وبيه نعدي لو بنفكر في ولادنا هدفنا واحد
القضية السكانية قضية شعب
The population issue is an issue of the people with the same objective, healthy citizens for sustainable development. Mr. President, we are going to go for a short break and then we will witness the panel.
مشاهدينا الكرام، ما زلنا معكم من داخل فندق الماسة من العاصمة الإدارية، حيث يعقد المؤتمر العالمي للسكان والصحة والتنمية حتى 8 سبتمبر بحضور ورعاية السيد رئيس الجمهورية.
Under the auspices of President Sisi,
تحت شعار
under the slogan of healthy citizens for the sustainable development, this conference is held. We are talking about citizens, healthy, sustainable development, three issues discussed through this international congress. Some axes related to these three axes to have sustainable development. We should have a high level of services provided to citizens to be healthy citizens able to work and produce, to reach welfare in society. The main problem is the lack of balance between the economic growth and the population growth. The increased population in Egypt makes the citizen do not feel the economic growth, because this population growth takes over any impact of the economic growth. The main purpose is investing in the human element and finding job opportunities to improve the quality of life and alleviating the level of the life of Egyptian citizens. The Egyptian Constitution 41, Article 41, the state commits to a population program to achieve the balance between the economic growth and the population growth. Through this conference, there are discussions exchanging visions and expertise and experiences in different states who had the same problems and managed to overcome the population challenges. They are up for discussion and dialogue and exchanging visions around the population in Bangladesh, Morocco, Malaysia. Egypt is still so far suffering the implication of this population issue and the huge increase in the growth rate. So this conference, the International Conference for Population Health and Development, attended by experts from all over the world and different organizations regionally and internationally and locally. The talk here is about the elements leading to supporting the state in facing and overcoming the challenges of the population issue, supporting the Egyptian family and providing social advantages to families, social protection programs events and programs for family planning, which is a program that Egypt established recently. The family planning in Egypt started from the 60s and they are constant so far in Egypt, and we are still following up the Egyptian efforts in the family planning field. Yes, as you have mentioned, there is a lot to be added and done over the years. If we focused on the 80s, the 90s, we reached what's called the population and demographic gap in this timing, when the resources do not meet the requirements. When the population growth is overtaking the economic growth, this is the core problem.
يعني الحديث حول مثل هذا الموضوع
Also speaking
ينسحبنا
about
إلى
this
أن
population
نتطرق إلى
issue
القطاعات
takes us
المختلفة
to different
التي حدث
sectors
فيها نمو لكن
where
لم يحدث
there
فيها
was
تكافؤ مع
development but not imbalance with the
في عدد
population
السكان قد
aspect.
التهم التنمية. قطاعات النقل كانت
The
مهزومة في
population still
سنوات
took over the
التسعينات
economic growth rate
وبعدها
in the
قطاعات
90s,
كثيرة
and then
ربما
many
ما
sectors
نواجهه من
of what
تحديات
we
في
face
مسألة
of
الاستيراد
challenges
وتكبر
in
في
the
مسألة الزراعة
importing
والسلع أيضا
matter,
التي
the
تستخدم في
agriculture and
التغذية
commodities
في
used
يعني
for
التصنيع الزراعي.
and food
لدينا
commodities
مشكلات هنا
and
لكن
the
أيضا يجب أن
agricultural
تعمل استراتيجية
industrialization
على حلها. فقط ما
that
نوه إليه
the
هو
strategy is
الفارق ما بين
tackling and
فكرة
dealing
الموارد
with
وفكرة الثروات
the
تتحول الموارد إلى ثروات.
idea
الثروات
of
هي الموارد لكن في صورتها التي يمكن أن تحقق
the
إضافة
resources
حقيقية
turning into wealth.
هو الثروة البشرية، تحويل
And you also mentioning the human element turning into wealth and used as a resource. As the Ministry of Health have mentioned,
التركيبة السكانية، وجود سكان على قدر كبير من التعليم يتمتعون بصحة جيدة، فبالتالي تكون فرص العمل متوفرة ويكون
we have job opportunities, we have high productivity rates, so we have influence and impact between the population feeling the economic growth. The national projects taking place in Egypt to serve the population and the efforts in the education and health sectors. The presidential initiatives are for providing a healthy environment for the Egyptian citizens to help them to be empowered and to work in a healthy environment. There is also great attention to child health, and we're talking about the 1,000 golden days mentioned by the Minister of Health as the first 1,000 days in the child's life, the first 3 years, which affected their future. Let me try to outline some points. It's either we increase the population growth rate to meet the resources, or improve the demographic properties and the population capacities for development and add real value to have a good quality of life. But there is another solution, and that's what we're trying to approach, to do both, to improve the population properties, education, health, capacities, industry, agriculture, and so on, the ability to deal with life problems and psychological status even, as well as the state works according to plans to reduce the increased population growth rates. You're talking about the population strategy proposed by the ministry during this Congress. We are going to complete the ceremony of the Congress today, and we are waiting for the first session of this conference, which will start in a while. And we remind you, this conference is under the auspices of President Sisi. This is the first break, and there will be the president will check out some of the expo aspects.
لو نعمل اللي علينا هنعدي بسلام، هدفنا واحد، رغم التعب لسه الأمل قدامنا.
على مدار 4 أيام تستضيف مصر المؤتمر العالمي للسكان والصحة والتنمية في وقت أصبحت فيه القضية السكانية قضية ملحة ليست في مصر فقط
It's a very pressing cause, not only for Egypt but worldwide. We have Dr. Khaled Abdul Ghaffar, Minister of Health and Population. Welcome, sir. What is the importance of this global congress in Egypt? Of course, the theme is evident. We're talking about a global congress. All health institutions around the world are attending. Egypt hosted in '94, in the same day, September 5th, a global conference that changed the view of population and health issues in the world. It's very important in Egypt. The population issue, we increased by 2.2% every year, which is a population growth rate 1,600,000 people a year, which is a great burden on the development plans and investment and the quality of life in general. And as far as we go with the economic plans, we need vaccines, we need schools, we need housing, we need jobs. The states that started with us achieved a lot of successes that ended with the reaping the demographic dividend. We have this program today, the strategy that we're launching through the conference to achieve the Egyptian dream that started from the 60s, the national strategies for population that launched through the Congress. Since the President assigned the ministry to work on population, it's not only about the state, but it is substantial for all sectors.
من الستينات زي ما انا قلت في وضع استراتيجيات ومؤتمرات وتشكيل لجان قوميه ومجلس قومي للسكان فقعدنا مع كل الجهات دي وحطينا
We had a sit down with all relevant entities and developed a plan for all Egyptian fields to reach the targets that we all know through the strategy. The reproduction rate is 8.2. We need to reach 1.5. We have a roadmap and we have a real segmentation of an anatomy of the Egyptian status. We have political will and leadership. As the President attends a Congress today, the entire state is working together to reach the demographic properties that we all hope for. The cooperation between Egypt and the UN Fund for Population, all the American Agency for Development, all these entities working in Egypt years ago and are part of this strategy because it is local, but it is in line with international standards on all levels. Is it binding somehow? The conferences are means, not a target. It is the start of the strategy and activating the strategies through launching it. And the guarantee is the political will represented in President Sisi when they took over the hepatitis C elimination matter. It achieved huge success rates. The WHO now is waiting for the
وعلى فكرة ده غير مفاهيم
elimination of hepatitis C in Egypt certification by WHO. It is all done by the political will represented in President Sisi with a proper thinking and visions to be launched after the directives of the President in all state sectors.
كل التوفيق وجزيل الشكر لحضرتك معالي الوزير.
Thank you so much, Mr. Khalid Abdul Ghaffar, Minister of Health and Population.
مش من زمن بعيد، في أجيال لسه موجودين وسطينا